Have you ever sat in a doctor's office just feeling deeply frustrated because your complex, exhausting daily symptoms were brushed off as just an irregular period problem? If you're nodding along right now, I want you to know you're absolutely not alone. For decades, the medical system has treated polycystic ovary syndrome as this hyper-specific gynecological issue. But what if we've been looking at it entirely wrong? What if the very name, PCOS, is kind of blinding us to the fact that this is actually a whole-body, systemic metabolic disease? Today, we're going to validate everything you've been feeling. And even better, we're going to dive into the real science of how to actually fix it.
Welcome to this explainer. I am so thrilled you're here. We're going to dive straight into the true biological engine room of PCOS. Seriously, no more Band-Aid fixes, no more just masking symptoms with birth control, and absolutely no more guessing. We're going to map out exactly how this condition operates on the cellular level and how a really groundbreaking approach called AlmaSync is designed to finally break that vicious cycle.
Okay, let's dive into this. Here's our journey for today. First, redefining the problem, then the vicious cycle, followed by a single solution. After that, we'll look at how every ingredient works, and finally, the timeline for results. Let's get to it.
Section 1. Redefining the problem as a metabolic syndrome. So the traditional diagnostic checklist for PCOS, which is known as the Rotterdam criteria, basically looks for irregular ovulation, excess androgens, and polycystic ovaries on an ultrasound. And this affects roughly 5 to 10% of reproductive age women globally. But stopping just at the ovaries is incredibly misleading. In reality, PCOS is a multi-system metabolic syndrome. It impacts your cardiometabolic health, bringing elevated risks of fatty liver and type 2 diabetes. It shows up in dermatology as severe acne, unwanted facial hair, and even scalp hair loss. Plus, it heavily impacts mental health, driving significant rates of anxiety and depression. Honestly, the name PCOS is so inaccurate that there's actually an international consensus underway right now to rename the whole condition.
Moving to Section 2, the vicious cycle, a reinforcing loop. Now, the most empowering mental model you can adopt for PCOS is that it's not just one single broken part. It's a self-reinforcing loop. Think of it like a vicious cycle with 4 main steps. Step 1, insulin resistance. Step 2, androgen excess. Step 3, chronic inflammation. And Step 4, micronutrient deficiency. Each step literally triggers and worsens the next one. And honestly, this is exactly why taking a single target drug, like a standalone anti-androgen, so often fails. It just interrupts one point in a cycle that keeps regenerating itself from all the other nodes.
So the crucial starting point is mechanism 1, insulin resistance. Somewhere between 50 to 70% of women with PCOS have measurable insulin resistance. And yes, that absolutely includes lean women. Because your cells aren't responding properly to insulin, your pancreas basically panics and compensates by pumping out more of it. But that excess insulin doesn't just sit around. It travels to your ovaries and literally turns up the dial on testosterone production. It also lowers the protein in your blood that's supposed to mop up that excess testosterone. So insulin resistance is really the central driver and the unifying feature of this entire cycle.
This overproduction of insulin feeds right into mechanism 2, hyperandrogenism. Now, this isn't just extra testosterone. It's a fundamental disruption of the delicate hormonal balance your body needs to mature an egg. Those excess androgens override normal follicle growth, causing them to just arrest mid-development. This is exactly what creates that classic string of pearls look on an ultrasound. And clinically, well, it's what drives those really frustrating visible symptoms, the persistent acne, the unwanted facial hair, the thinning hair on your head. And remember the loop? This androgen excess turns right around and amplifies the insulin resistance we just talked about. Which brings us directly to mechanism 3, chronic low-grade inflammation and oxidative stress. Women with PCOS actually show elevated markers of systemic inflammation, and this is completely independent of their body weight. This is a huge deal for 2 reasons. First, oxidative stress directly damages oocyte or egg quality. And second, systemic inflammation directly impairs your insulin receptors. It basically makes them deaf to the insulin signal, which worsens your insulin resistance, which then increases testosterone, which then increases inflammation. You see the loop just completely closes in on itself? And finally, mechanism 4, micronutrient deficiencies. These act as a massive accelerant to the fire. You see, PCOS creates a metabolic environment that rapidly depletes your body of essential minerals. Magnesium is pretty much universally deficient in PCOS, and you literally need it for insulin to signal properly.
Up to 85% of PCOS patients are deficient in vitamin D. Low zinc directly worsens hirsutism and oxidative stress. And selenium, it's a required cofactor for your body's main antioxidant defense. So being drained of these nutrients isn't just a side effect, it's a deficiency state that actively feeds right back into the vicious cycle. All right, section 3, a single unified solution for breaking the loop. If you've been trying to manage your PCOS, your bathroom counter probably looks like a chaotic pharmacy right now. The old way means buying dozens of individual supplement bottles, guessing at confusing dosages, and frankly wasting a lot of money on poorly absorbed forms like cheap magnesium oxide. It is just exhausting. Well, the new way is AlmaSync. Instead of swallowing a random handful of pills every morning, it's a single, scientifically dosed daily sachet. It's designed specifically to hit every single point on that vicious cycle we just mapped out. Section 4, how every ingredient works through evidence-based dosing. Now, what's really interesting here are our Tier 1 ingredients. These have the absolute strongest randomized controlled trial evidence behind them. First up is astaxanthin. It's backed by a 2024 triple-blind trial showing it significantly lowers inflammation, insulin resistance, and oxidative damage to oocytes. And then we have NAC, or N-acetyl-L-cysteine. NAC directly restocks your body's master antioxidant, glutathione. A massive meta-analysis of over 2,300 women actually showed NAC dramatically improves insulin sensitivity and ovulation rates. It's a real game changer. And I really want to highlight this massive number you're seeing, 1,200. AlmaSync uses a huge 1,200 milligram clinical dose of NAC. This total active load is exactly why AlmaSync has to come in a powder sachet. You simply could not fit this level of clinically dosed powder into a standard capsule count without forcing you to swallow like a dozen pills a day. Moving to our Tier 2 ingredients, which have very strong, moderate-level clinical backing. Notice we use magnesium glycinate, not that cheap oxide form that just runs right through you. The glycinate form ensures your insulin receptors can actually absorb it and signal properly. We also have alpha-lipoic acid and chromium to further support that insulin mechanism. And crucially, 400 milligrams of spearmint extract. Clinical trials show spearmint directly targets and lowers the excess androgens that are driving those frustrating visible symptoms like hair loss and acne. Also in Tier 2, we are actively reversing that micronutrient deficiency loop. By replenishing zinc, selenium, and vitamin D3, we're stepping in and restocking the exact minerals your body is burning through when it's fighting PCOS. This lowers your oxidative stress and shores up your metabolism, so that vicious cycle finally loses its fuel. We also include foundational support. And in the spirit of complete scientific transparency, methylfolate is in there because it's a highly absorbable B vitamin essential for cardiovascular health and lowering homocysteine, which is often elevated in PCOS. Then there's marula extract. This is a brilliant traditional botanical from sub-Saharan Africa. While it doesn't have direct human PCOS trials just yet, it has incredibly strong mechanistic and animal data supporting liver health and lipid metabolism, and that is vital, since PCOS carries such a high risk for fatty liver. Let's wrap things up with Section 5, the timeline for real results and biological healing. And this brilliantly illustrates how true biological healing actually works. You really have to be patient with your body's natural rhythms. Around 4 weeks, internal hormonal shifts begin, like the spearmint starting to lower those circulating androgens. By 8 weeks, clinical markers for insulin resistance and systemic inflammation start to noticeably improve. But please hear this. Visible cosmetic changes, like a reduction in unwanted hair or getting a regular menstrual cycle back, those take 3 or more months. That's simply because hair follicles and ovarian follicles cycle very slowly. We are rebuilding the foundation here, not just slapping on a quick coat of paint. So I'll leave you with this final thought. Are you ready to stop just treating the symptoms and finally break the vicious cycle? Today, we've seen undeniable proof that PCOS is a systemic, interconnected loop. But much more importantly, we've seen that you don't have to rely on a broken system of random, improperly dosed pills. You can target every single mechanism with one unified, science-backed solution. Thank you so much for joining me in this explainer. Keep learning, keep advocating for your health, and I'll see you next time.